Dr. Stuart Fishbein. I am an obstetrician and gynecologist in private practice. I have two offices, one in Century City, one in Camarillo, California. I work closely with midwives. I'm a believer in the birth choice movement, and I'm supportive of birth choices for women. I've been practicing obstetrics since my residency finished in 1986, which would make it 23 years. I do believe that some cesarean sections are necessary. There are obviously some radical people out there who believe that it's almost never necessary. Certainly there are cases where babies are malpositioned in such a way that they're not conducive to delivering vaginally, and that could be a transverse lie, it could be a breech baby that's got its feet in the wrong place, it could be a baby that is too premature, it could be a uterus that has been previously scarred by certain surgeries like a fibroid surgery where they cut through the entire uterus. It could be a woman in labor who has really had a good, fair trial of labor with adequate contractions for an adequate period of time and is not progressing. It could be that the placenta is in a wrong place, covering the exit to the uterus, called a placenta previa, or possibly even a placenta that separates early, causing a lot of bleeding and possible fetal distress, called a placental abruption. I do believe that women have the right to choose an elective cesarean section, even in the absence of any real true medical indication, as long as they're well informed and well counseled. Just as I feel the opposite should be an option, where a woman who's had a previous cesarean section, who's been well counseled and educated, who chooses to have a vaginal birth attempt, should be allowed to do so as well. Well, the benefits of cesarean section are in my mind, a lot smaller than the risks of cesarean section. But of course, benefits are that if it's necessary, it's going to protect the baby in certain circumstances. But you're substituting in, of course, a lot of potential complications that go with a cesarean section, such as the need for a repeat cesarean section, the possibility that you'll have increased blood loss or infection, or those risks are higher with a cesarean section. The possibility of a complication occurring because of the surgery, such as a bowel obstruction or adhesions causing pain, the possibility that the scar may cause problems with the implantation of the future placenta, the possibility that babies are born by cesarean section have a slight increased risk of respiratory problems, and there is data to show that they have an increased risk of childhood asthma. The recovery period is longer, the cost is higher. When I trained in the 80s, there was a protocol for doing what's called selected breech vaginal delivery. And the criteria briefly were the baby was not too small or too big, the baby was in what's called a frank or complete breech presentation, where the butt is actually what's presenting first, not the feet, not 1 foot up, not 1 foot down, but in a certain position, that the head was flexed, that the environment around the baby was safe. And if those criteria were met, that a woman could choose to have a vaginal birth. What's changed is liability, I think, has caused people to believe that if a baby is born by breech, it has lower APGAR scores or has a problem after birth, or even years later, that there's a potential for a legal action in our country. And so what's happened is that breeches have been gradually squeezed towards cesarean section, and the training of doing vaginal breech deliveries has been disappearing from our residency programs. It is still an option. It should certainly be an option. The American College of Obstetrics and Gynecology, which of course I don't always agree with, but on this particular case, they have a statement that says that if the patient desires it, if the practitioner is capable, and if the certain criteria that we discussed are met, that a trial of a breech vaginal birth is a perfectly reasonable option. Interestingly enough, just the timing of this interview, last week there was a story I saw in the Edmonton Journal that the Canadian government has come out with a statement that's saying they are no longer going to automatically recommend cesarean sections for selected breech deliveries, partly because they're trying to lower their costs, and hopefully it's also guided by the fact that they think it's better for women to deliver vaginally if they can. If the first baby is head first, and they're not very, very premature, there is really no reason to not let the woman attempt to have a vaginal birth. Even if the second baby isn't head first, what's called a total breech extraction after the first baby comes out is quite easy to do. It is not like a breech vaginal birth, so the skill is slightly different. It can be easily taught. Well, the safest way to be born in almost every circumstance would be a vaginal birth. And in a low-risk pregnancy, it would be a vaginal birth with as little intervention as possible. Again, these choices have to be made with patients who are given true informed consent and are well educated. A problem arises many times in that women are not well educated, don't choose to educate themselves, or are in practices where they're not given true informed consent. They're often given what I call skewed informed consent. They're given information to lead them down the path that the practice or the physician or the midwife wants them to take. Such as a woman who's had a previous cesarean section, if they're constantly told that the risk is that you will rupture your uterus and your baby will die if you have a vaginal attempt, then you'd be crazy to choose to have a vaginal attempt. But that's not fair, because there's so much other information that needs to be given in order for a woman to make a proper choice. So as far as the question being what's best for a low-risk pregnancy, a low-risk pregnancy should be a non-interventionist birth in a setting that suits the parents with as much support and peace and quiet as possible. You can see that I'm biased, quite frankly, toward a woman having a vaginal birth if at all possible.